First off, in myofascial massage, you're going to check the condition of the tissue throughout the whole back. You're going to start with a little bit of just shifting and compressions just to check the condition. You're going to get a good size of skin, and you're going to gently but firmly grasp the skin over a spot on the upper back and lift the skin until tension is felt. So basically lift until you feel like the skin is resisting you, because that is tight fascia. You're going to hold each area for as long as it needs. 2 to 3 minutes is usually good. If they're superficially loose in their fascial connections, then you won't have to hold this as long. It's just if they get tight, you're going to have to hold it longer or readjust. As you move throughout the back, you're going to feel where there's places that are tighter, where there's looser. So using your information that you have and your intuition to be able to find those places and be able to hold them longer. At any of these spots, you can add a directional shift, or you can hold it at a different angle. That's just allowing a little bit of movement with each lift. You can move it back and forth, give it a little bit of shifting, jostling, just to try to encourage it to relax. You're going to find places that are a little bit tougher to get a hold of. That just means one of the fascial lines of the body is tighter, and it will need a little bit coercing to relax a little bit. And you'll do this throughout the whole back. It will be harder in the low back because fascia is just naturally tighter in the low back. Just be patient. Myofascial release takes a while. The client in the video is up on his self-care, so his fascia is not as tight, as you can see. Most clients, it will be very hard to be able to lift skin the way that I am in this video. Just be careful not to pinch the client at all. This is very gentle but a firm, broad grip. Like I said, you can change directions to check the conditions of the tissues, connect, and see if there's any fascial pulling in different directions. The way that you apply this is by laying your thumbs down and just almost claw handing the skin in between your fingers and the broad part of your thumb. You're not trying to poke your thumbs in. You'll wear your thumbs out very, very quickly if you do that. You want to make sure you're engaging the thenar part of your thumb during this process. Remember, this part is just a gentle lifting of the skin to try to break away from that superficial layer of fascia. And I'll just reiterate, most times you will have to hold it longer than I am in this video, but this client's superficial layer of fascia is looser than you will find in most people. You'll find that there's a couple places where I kind of jostle a little bit, where I add a directional shift to the skin lifting, and that's because I found something that's tighter, that's fighting a little bit more. And so you kind of have to encourage it to loosen up. When you feel it release is when you can move on to a new area. Be a little bit more gentle around the connections in the lower back. Some people can be very sensitive, especially if they're fascially tight in that area. Just be very mindful of how your client's doing. Make sure they're breathing, and make sure that they're not tightening up every time you go to try to release the fascia. With some clients, you'll find that they're tighter on one side of the body than on others. Just be mindful of that. You may spend more time on one side of the body than you do on the other, or you may spend more time in the low back than you do in the upper back. Always tailor this treatment to your client.